Hello dear subscribers. Today we will talk about one of the most important organs of our body, the liver. Since ancient times, people have called the liver the source of life and knew that it is one of the most important organs of the human body. Scientists and doctors now have a complete understanding of how this gland works, what it secretes, and what can damage it. Thanks to this, we managed to keep the liver in good condition for many years. The liver is considered the largest gland in the human body. It is located on the right side of the abdominal cavity, under the intercostal space. The liver performs several basic functions, such as metabolism. In the liver, proteins are broken down to amino acids. The most important compound, glycogen, is synthesized, in which excess glucose is processed, and fat metabolism also occurs. The liver is sometimes called the fat depot. In addition, the metabolism of vitamins and hormones is carried out in the liver. Detoxification. Various toxins and bacteria are neutralized in the liver, after which the results of their decomposition are excreted by the kidneys. Synthesis. The liver also produces bile, a yellow-green liquid made up of water, bile salts, and a pigment called bilirubin. Bile is involved in the digestion of fats, the absorption of vitamins, stimulates intestinal motility. Thus, normal metabolism in the body is impossible without the proper functioning of the liver. And that is why it is necessary to know what factors cause liver disease in order to avoid their development. The following are the most dangerous. Alcohol abuse. The main metabolism of ethanol contained in alcoholic beverages occurs in the liver. With small volumes of alcohol, liver cells are able to process it. When a reasonable amount is exceeded, ethanol contributes to damage to liver cells, fatty deposits, inflammation, alcoholic hepatitis, and destruction. At the same time, excessive formation of connective tissue is observed in the liver. Fibrosis and later cirrhosis and even cancer are possible. A patient with alcoholic liver disease may complain of weakness, a general decrease in tone and appetite, and indigestion. Gradually, these symptoms increase. They are joined by tachycardia, as well as jaundice, improper nutrition, the abundance of fatty foods, and a decrease in physical activity led to the fact that fat metabolism in the body is disturbed. As a result, fat begins to accumulate in the liver cells, causing their degeneration. This leads to the active formation of free radicals, particles that carry an electrical charge that are dangerous for cells. Foci of inflammation and necrosis appear in the liver, and cirrhosis may develop over time. Violation of the rules for taking medications and exposure to toxic substances. Uncontrolled medication leads to an increase in the load on the liver because it processes the bulk of the drugs. It is estimated that drug-induced liver damage accounts for up to 10% of all drug side effects in the body, and symptoms may appear up to 90 days after discontinuation. There are other substances that are dangerous toxins for the liver, such as industrial and vegetable poisons. Substances that have a toxic effect on the liver led to the destruction of cell membranes, led to the destruction of liver cells, and can cause hepatitis and liver failure. Patients complain of pain in the liver, general weakness, jaundice may develop. Virus attack. The impact of viruses on the liver is dangerous primarily by the development of viral hepatitis. This is an inflammatory disease of the liver, which, depending on the type of virus, can even be fatal. Often the disease is asymptomatic. Sometimes patients complain of discomfort, fever, pain in the right side of the abdomen, jaundice. In severe hepatitis, necrosis of the liver tissue may begin. Liver dysfunction can be characterized by non-specific symptoms characteristic of other diseases, so it is not always possible to make an unambiguous conclusion that the patient has experienced liver disease. Patients report a deterioration in well-being, decreased appetite, defecation disorders, frequent colds, a tendency to allergic reactions, skin itching, irritability, as well as toxins that are neutralized in the liver, have a negative effect on brain cells. Of the specific signs of impaired liver function, the following can be distinguished: pain in the right side, feeling of heaviness, abdominal discomfort, nausea, feeling of bitterness in the mouth. The most striking sign of liver disease is, of course, jaundice, discoloration of the skin and mucous membranes. This is due to the accumulation of bilirubin in the blood. One of the first steps to maintaining liver health is diet control. The presence of a large amount of fatty foods, alcohol, fried and refined foods negatively affects the health of the gland. Food should not be plentiful. It is better to eat 3 to 4 times a day in moderate portions. To neutralize the harmful effects on the liver, you can carry out preventive cleaning. Mix equal amounts of freshly squeezed lemon juice, unsweetened pure honey, and extra virgin olive oil. Take 1 tablespoon 3 times daily on an empty stomach, 15 minutes before meals. During the cleansing, allow the liver to recover, eliminating the abuse of harmful foods and drinks. Let me remind you that this method is preventive in nature. If you have any health problems or pathologies, you should consult your doctor before using it. For advice, you can contact the WhatsApp number that you see on your screen. Subscribe also to our YouTube page and share the comments. You can also subscribe to our Telegram, Instagram, and Facebook pages. Links can be found in the descriptions of this video. Thanks for watching. Stay healthy.